Our spinal cord is protected by the bony vertebra of our backbone and the ligaments. Underneath this are the meninges, and these are the protective layers you're looking at there. Pia mater is the innermost, where we have ligaments that keep the spinal cord in place so we don't have a lot of shifting. What we're watching here is a recumbent position for a lumbar puncture or a spinal tap, same thing. The line is across the iliac crest, and it's really important to recognize the position of the spinal cord. It ends near the conus medullaris, and from here we have the cauda equina, where we can collect cerebral spinal fluid, L3 through L5, without puncturing the spinal cord. Little palpation there. Fingers are very useful in medicine. Even when we have expensive equipment, we like to palpate. Mark the target. It's best if you have the patient or sometimes the patient's family member mark it. Sometimes. This is important because when we're sterilizing the wound, we go in circles, because if there's bacteria at the insertion site, we want to spread them away from the site of entry. Draping sometimes for patient comfort, privacy. When the spinal tap is done, the cerebral spinal fluid should be clear. And if there's some red clots in there, that means we may have damaged the meninges. In some cases, we have to reposition the needle, and we're trying to get the some of the fluids. Some of it's in the arachnoid mater and the dura mater. Dura meaning tough mother, and it's the superficial layer, meaning it's on the outside of the meninges. Okay, I think we'll move on. I'll be talking here. It is the spinal tap here. The major nerve regions, we have cervical, think of the neck, C1 to C8. We have the thoracic nerves, 1 through 9. And I mentioned in that video the conus medullaris. So this is the area where the spinal cord terminates. Lumbar nerves, the cauda equina, which is, cauda equina means the horse's tail. In fact, it does kind of look like a horse's tail. With the nerves are separate and spread out a little bit. Spinal tap or lumbar puncture, I talked about. The cerebral spinal fluid extracted from the subarachnoid space. And we want to hit lumbar 3 to 5, because here we're below that fragile spinal cord, but we're still in a region where there's cerebral spinal fluid flowing. Because we want to check for pressure of that fluid. And also, we're going to examine it for bacteria, viruses, fungi, and sometimes medicines or dyes are injected for imaging. Spinal cord anatomy. This is what it looks like under the microscope, but I like the simplified diagram, because if we understand this, then we can understand what we see through a microscope. Central canal extends the whole way down the spinal cord, and this is where we have cerebral spinal fluid. That motor oil consistency, mostly clear fluid, flowing constantly. Posterior gray horn, let's take posterior. So if this, I can't get my point there. If this is the posterior gray horn, then we know we're looking at the back or the posterior part of the body. And it's going to receive impulses from sensory nerves. And then the anterior, which is going to be in the front, is to motor neurons. And I'll go through this in a little while. I'll give you an example. White matter has these myelinated axons, and neurons tend to be arranged in tracts. We have sensory tracts, and these are going to transfer impulses to the brain. White matter, I mentioned it's white because of the myelin. When we have a spinal cord injury, it can result in anything from a quadriplegia to paraplegia. It's often due to some kind of compression of the spinal cord, such as trauma, or sometimes a blood clot or a tumor is applying pressure. We have what's called a complete transection, where all the, and here we have, let's see, yeah, everything below that complete transection is going to be dysfunctional, and which is dangerous if something like the innervation of the diaphragm is ceased, then we need a ventilator on. So the transection, the severity really depends on how far down on the spine the trauma occurs. For example, lumbar between 1 and 2, you can still walk, but you may need braces. Loss of reflexes, arflexia, that often happens within the first hour of spinal injury, spinal shock. Hemisection is just partial transection, and it really depends on the location and the extent. So you can have, here you have kind of different areas. Some there's sensory and some are not. If we can inject a corticosteroid to suppress inflammation within the first 8 hours, we can often reduce damage due to edema or swelling. So real important when there's a spinal cord injury, first 8 hours are crucial in reducing long-term damage. Plexus is just a collection of nerves. So we have a good example here. The cervical, you can see in yellow. And so before going straight to the target that they innervate, they're going to form a network. And we have the cervical plexus, C1 through C5, as you might guess. Skin and muscles of the head, upper shoulders. Interesting, the Duchenne palsy can be caused by stretching an infant's neck during childbirth. And this is common. You may think, well, who would do that? But childbirth can be a very traumatic and shocking experience for anyone who's delivering that child, because we're also worrying about the airway and many other things. So caution has to be taken with that neck. Also, during our lifetime as an adult, if we compress some of those vertebrae, the cervicals, then we can have this. And here it is. Here's the medially rotated arm with a flexed wrist, sometimes called the, I think, waiter's tip posture, but I don't like that word. Brachial plexus is the shoulders, and as you might guess, it's going to influence the arms and the hands, the muscles, and the skin here. If we have radial nerve injury, we get this wrist drop, which you see to the right, and that's when we put something on too tightly, like maybe a tourniquet or a cast on the mid-humeral, mid-arm region. Medial nerve injury, and the medial can be injured through something simple like setting up an IV or a blood draw, right? So it happens, and there's different degrees of this median nerve palsy. Sometimes just tingling and pain in the palm and the fingers, it may go away, and sometimes it's a lifetime. The lumbar plexus, L1 to L5, skin and muscles in the lower back, pelvis, scrotum in males, and labia major in females. If we have a femoral nerve injury, and we get this from any kind of puncture, but we often think of gunshots and stabbings, at least in city environments, they may have the inability, and here we have an example, to extend the leg, and sometimes the anterior lateral part of the skin, the femoral area, is desensitized. Sacrococcygeal plexus, lumbar 4 through sacral 5, so we're going all through the sacral. Buttocks perineal, which if perineal is the inferior position here, and the lower limbs. Now, the plexus here will join to form the sciatic nerve, and I chose this picture because the piriformis sometimes is a muscle that is inflamed. It's one of the deep muscles to the gluteus maximus, and it will apply pressure to the sciatic. So sometimes sciatic pain is due to a muscular inflammation, but not always. You can have herniation of a vertebral disc, any of these other rotator muscles, and even pressure during pregnancy is going to apply pressure, and we have sciatica. The tibial part of sciatic, if you have injury there, sometimes you get this dorsiflexion and eversion of the foot. You see to the far right, and that's an indication of sciatic down, inferior, so down on the lower leg. Shingles, an acute infection of the peripheral, so the PNS here, by herpes zoster. So if you've ever had chickenpox, you're not aware of it, but the root ganglia, which is here on the side of the spinal cord, the virus kind of hangs out, and until activated, often if our immune system's depressed, this happens sometimes as we're older, but it can happen to young people as well if they're not getting enough sleep, or they're depressed, Their diet's terrible. The blistering of the skin, very painful. And these blisters are sort of like they're noting the location of the nerve that's infected. Reflexes, we have this is a patellar reflex here. I like this. Reflexes, there's different types. There's many different types. Some are conscious and they come through practice, and others are reflex arcs. And let's just take a look at this reflex arc. The sensory, so here's the hammer. It's going to cause some stretching of the patellar ligament. And when that ligament stretches, it sends a sensory impulse to the spinal cord. And now the spinal cord is going to send it through an effector. It's really a motor neuron, and it causes a contraction. Reflex arc. An epidural block is an injection of an anesthetic, which we're thinking of pain relief here, right? Or corticosteroid, which is going to reduce inflammation and ultimately reduce pain. It's going to be a very precise insertion of the needle, because we want the needle to stop before it hits the dura mater. Sorry, here's the dura mater, and there's an arachnoid space where we can collect some fluid or we can inject the medicine. And the bevel has to be in the right position, or we're going to slice through some of the outer layers of the meninges. Speaking of meninges, there's meningitis, and if you recall, the meninges, let's have a little review here. We have these different layers, the dura mater, the tough mother on the outside, next to the bone, in this case the skull. Then we have the arachnoid layer with the arachnoid space. It doesn't show the space here, but there's fluid where we sometimes collect for a spinal tap. And then the pia mater, which sometimes adheres right to the nervous tissue, such as the brain. So if we have inflammation of any of these layers, you can look, see there's no place for the edema or swelling to go because it's enclosed by the skull. And for that reason, it's a common, it's one of the major causes of mental retardation in children, because the brain cannot sustain much swelling. There is a vaccine that works against some, and bacterial tends to be the most dangerous of the meningitis, although there is viral and there's fungal as well. Hey, I didn't mention this. Here is an example of that spinal tap, lumbar puncture. There's the dura, just call it dura mater, and a catheter. Cauda equina, if you recall, the spinal cord is really very fragile, and we don't want to insert a needle in that area, so we go down to the region of the cauda equina, conus medullaris up here. Stiff neck, fever, and headache, but not always. Those and if you do have these, it doesn't mean you have meningitis. It's just when we see that, especially in someone young and someone who's very weak and lethargic, then we start to worry, especially if the fever is high and it persists.